Hi everybody, my name is Stacey Castro. I'm the Chief Marketing Officer here at Highlands. I'm going to talk to you today a little bit about aphasia and kind of the effects that it can have on the body and ways that hopefully you can overcome the diagnosis. Aphasia is an acquired language disorder that can affect a person's ability to generate or comprehend verbal or written language, although it still leaves the intellect intact. It is a result of the brain being damaged in parts of it that control your language functions. We've all had that tip of the tongue feeling where we can't find the word, or we really wonder if we understand what the other person is trying to say, and it can be very frustrating for us who have it happen occasionally. For people with aphasia, however, these can be unrelenting occurrences that they have to deal with multiple times a day. Aphasia actually affects over 80,000 stroke victims per year, yet people with the disorder often find that they are an unheard of population. It can cause depression and social isolation, sorry guys, are common in people with aphasia, particularly if they are not participating in speech therapy or support groups regularly. Caregivers are also profoundly affected if their loved one has aphasia as well. They may feel the burden of having to do all the talking and may miss intimacy of a shared conversation. Treatment is usually customized to the individual's needs rather than a one-size-fits-all approach. So here at Highlands, we definitely recommend that if you have a stroke and you're in the hospital, that you request that you have inpatient rehabilitation after you leave the hospital and are ready for discharge. This is going to help speed up your recovery and give you the tools that you need in order to continue getting better and feeling better and working with your progress. When you get here to Highlands, we will have you meet with a speech language pathologist. This speech language pathologist will develop a treatment plan that is individual to your needs and what is going to help you recover the fastest. Once she or he comes up with that treatment plan, they will meet with our physician who will discuss it, and then they'll come up with a whole body approach to help with any other things that may be affecting you. At that time, we will watch your recovery. If we need to tweak anything, we can tweak it as we go along, but it's definitely gonna give you the tools to be able to take those home with you and continue your recovery. There is actually no one method for preventing Broca's aphasia or any type of aphasia. One way to try to prevent it is reducing your risk of having a stroke. This may require such things as smoking cessation, lowering your alcohol consumption, and losing weight. Not fun for any of us, that's hard for all of us, but it's something that will definitely help you go through life and reduce your risk of a stroke. However, this is a very exciting time in aphasia research. Scientists are investigating methods to change the way the brain recovers. The ability for the brain to adapt and change is known as brain plasticity. Experimental techniques such as non-invasive brain stimulation that promote brain plasticity are now being investigated for aphasia recovery, as are other forms of intensive aphasia treatment. Recovery actually doesn't stop though when your speech therapy ends. You continue having to work really hard, and in order to be able to do that, you need the tools and the education to speed up your recovery and be able to work on those things when you return home. Definitely inpatient rehabilitation will help with your progress and your recovery. Thank you all for your time. I appreciate it. I hope you learned some about aphasia, and have a wonderful day.